Our bodies are made up of millions of tiny cells. Cancer is a disease caused by abnormal or broken cells that grow out of control. Healthy cells know when to stop dividing. Broken cancer cells rapidly divide out of control. As they grow out of control, these cells can lump together to make tumors. Cancer can start in many different parts of your body. They can also break away and spread to other parts of your body through your blood. Chemotherapy is a strong medicine used to treat cancer in your body. It may be given directly into your vein through an IV or given as pills you take by mouth. Chemotherapy drugs are used to kill cancer cells. The key thing about cancer cells is that they grow rapidly. Chemotherapy drugs are used to stop cancer cells from rapidly dividing. Chemotherapy can also kill other rapidly dividing cells in your body, like your skin, hair, and stomach. The reason doctors give you chemotherapy is to kill cancer cells that divide rapidly. Palliative chemotherapy tries to shrink your tumor. Cancer causes side effects. Shrinking your tumor tries to eliminate these side effects. Palliative chemotherapy does not cure your cancer, nor does it kill all the cancer cells. Palliative chemotherapy is not hospice. It tries to shrink your tumor in order to eliminate bad side effects caused by your cancer. Curative treatment is given to kill all cancer in a patient. Curative treatment can be different kinds of treatment depending on what will kill your cancer. It could be chemotherapy, radiation, surgery, or a combination of any one of these. However, the idea is to kill all the cancer. Blood contains a few different kinds of cells. To get a blood count, a little blood is taken out of you and then tested. This test shows how many good white blood cells you have, which help to fight off infection, how many good red blood cells you have, which give you energy, and how many platelets you have, which protect you from bleeding. Overall, a blood count tells us the kinds of blood cells a patient has and the number in order to see if you are within the normal range. In treating cancer, the doctors get blood counts to see how you're doing and to see if you're strong enough to get your next chemotherapy treatment. Cancer treatments, like chemotherapy and radiation, lower your ability to fight off infections. This makes it easier for you to get sick. When doctors say you have a risk of infection, that means you have a higher chance of getting sick with colds, flus, or other diseases caused by germs. This is because chemotherapy and other cancer treatments weaken your body's ability to fight off bacteria and viruses. In order to stay well, you need to eat well, drink lots of water, sleep well, take all of your medicines, and wash your hands often. You should also avoid stress and avoid crowds. If you have a low-grade fever, which is a temperature at 100.4 or above, you should call your doctor. And be prepared to go to the hospital because you have an increased risk of infection.